Hello, my name is Marco Smit. I'm from Health.io. Thank you, Amy, for inviting me here. It's an honor to be here. And also for you, for those of you who don't know what Health.io is, we very early on started, and people still associate us with a little organization called Patients Like Me. So I'm sure all of you know Patients Like Me, and that's really where we had our origins, the patient communities. So let's see, are my slides up? All right, good. So what do we do? I'm going to tell you a little bit about who we are and what we do. And then I'm going to talk to you a little bit about all of you guys are working on advocacy. So let us put this in context for you. What else is happening out there in healthcare right now? What others are people doing around advocacy and changing healthcare, making healthcare more patient-centric? And then third of all, I'm going to give you some examples of what Amy just talked about. What are some technologies, what are some developments that you could use to maybe enrich your strength, to help your patient group that you're advocating for and your patient base? So very briefly, so this picture looked a lot more friendly when I was actually trying to take it from the internet. But we're supposed to be there in the eye of the storm because healthcare is, of course, going through a major storm right now, major flux. And so we are in the eye of the storm. We really try to be on top of it in terms of knowing everything that's going on. So we have data, relationships to companies, relationships to foundations. We do a lot of work with the Gordon and Betty Moore Foundation, which is all about how do we get hospitals to get better at using this new technology so that patients actually have better experiences, prevent readmissions that are avoidable. So we're building a database around that. We will show you later this year what are these companies out there, what are they doing. And then on the right-hand side, we Innovation Connections, we help organizations like yourself as well as big companies connect to smaller companies who are building great products but may not have the right audience yet or may not have as big an audience as they could have and should have. Let's see, we organize conferences. We had a small conference ourselves last week. We started about 4 or 5 years ago. We thought we were going to have about maybe 50 to 100 people who were interested in hearing about healthcare innovation. We had 500 show up. That was 4 years ago. Last week we had 2,200 people show up who wanted to somehow learn about what's going on in healthcare innovation or take advantage by connecting to companies, connecting to individuals. It's an indication of how much interest there is. Now I'm putting this up and I'm putting here the title from SV to DC because about 2 years ago or 3 years ago we were working with Anish Chopra and Todd Park. Anish Chopra was then the CTO of the US and he's basically saying we are trying to shape this policy to make healthcare more patient-centric, to make healthcare more data-driven. And the venture guys are not investing. So there's a message from DC to VC. You guys should be supporting these companies more. So what we're doing today is giving back, I guess, to you by showing so what is happening, what is being funded, what is sustainable, what is the frontier in Silicon Valley doing to try and change healthcare. And I'm saying Silicon Valley, but that's just we're from the observation post in Silicon Valley. But all the companies come from all over, literally not just from the US, all over, but also from all over the world. For the rest, we do work with Todd Park and his successor. Now, one thing I think that's important is back then, and this is something that may connect to what you're doing today even, patients like me and patient communities were very strong and really were all about making the voice of the patient heard. But it was really more around rich data, showing the stories of what's happening, and kind of leading by anecdote. And that was very important because that voice was not heard, and there were many barriers between the patient and the people who needed to hear the voice. However, what we are seeing, and this is something that you need to be really aware of, because whether you want it or not, this is happening. The healthcare industry is becoming much more data-driven. So when we say, if you look at this, the patient about the data about the individual, the population, and the reference, and that can be clinical reference or other population reference. Let's say Latinos will have a different population reference than Asians, than mixed populations, etc. This is something that all the players in healthcare are starting to really look at. I hear the voice of this patient, but how does he compare to the rest of the population? I hear this patient's story, but how does that compare to the reference of what I should be hearing, right? So in other words, I hear the voice, but hearing the patient's voice alone is not good enough anymore. I need to understand the patient voice in context. How does it compare to what am I expecting and what I should be hearing? And then the data utility layer, that really goes to the point that in the past, data was locked away in silos, and you were working at your patient advocacy group in a corner, and maybe in a different corner someone else was working on something similar, but it wasn't all coming together. So data utility layer really comes to the point of let's free up that data, let's make it visible, let's allow people to share it with whoever is necessary. I think the most important point of all of this, don't worry about the multi-access thing, that's not important. The key thing on the right-hand side, though, is the decisions and actions. Everyone in healthcare, payers, providers, pharma companies, technology companies, are trying to figure out is healthcare as it is today is not working. We are wasting a lot of money. We are making a lot of errors that are avoidable. How can we make better, smarter choices? And if that means listening more to the patient, then that's fine. But then how do I go from listening to the patient to making a smarter decision? And again, this is whether you're a payer or pharma company or someone or provider, it will be different. If you're a Kaiser, it's different from if you are a fee-for-service, standalone, small solo practitioner. But the questions are, we're not going to change anything in healthcare unless we change the decisions that we make. So now it's more a matter of like, how can technology help to make smarter decisions? So I said, putting what you're doing in context as well, is we have this database. So I'm going to show you 2 snapshots. This is our database. We use categorization that is unique to kind of track what's happening in the space. So you see the patient communities, which are very big there. And then also we have a lot of content providers, so people posting, trying to aggregate what patients have said and trying to build content around that. You should do this if you have RA in your early stages. So that was very big, and that was in 2010. We had about 110, 120 patient communities. If you look at this, there are 2 parts that are important. One is the number of patient communities has continued to grow. So it's not like they have died down. I think the interest in patient advocacy, patient communities has only grown. However, what has far outpaced that is the growth of self-management tools. And I'll be the first. I'm someone who's a business person by background, by training, a strategist. And if I'm a strategist and I see this level of growth in the self-management companies, I can tell you that no matter what happens, there'll be a lot of those that die. And there's nothing wrong with that. That's just the nature of an innovation. You have to try something, and there's a certain percentage that will fail and certain percentage that will succeed. So some people may say it's hype, but at the end of the day, it's real that there are now close to 375 self-management tracker and tool companies. And these are important because they get closer to this point about making decisions, right? The reason why United and Aetna, all these other companies are building these tools, as well as why other companies are building these tools, is because it's ultimately about these decisions and actions that people are taking. Now, I think what is interesting, let me see. Let's see, right. So what I think is interesting is, for example, we have a company called MedHelp. MedHelp is a patient community that attracts about 25 million patients per month. And one of the things that they do is they actually say, all right, we do 3 things. One is patients can talk about the issues that matter to them and share experiences. But the 2 other parts is, one is they can actually upload data from their devices. So they have partnerships with several device companies like Siemens and GE. And I think they're trying to make partnerships with Mayo Clinic and other organizations like that to say, if I as a patient if I go see a doctor and he does something and I can record it on my device, or I can record it on my app, or in, let's say, my UHC or something like that for United Health application, can I then feed it back into this so that next time I look, when I go through my patient communities or when I go to the MedHelp website, will you be able to tailor the content that you serve me to say, last time you had a visit and there was a concern about this issue. By the way, here are the most interesting posts on this issue. You don't have to go and just see that, but that's one of the ways in which they're trying to integrate the data from devices to decisions that you're trying to make. You had the doctor's visit, there was data generated and absorbed, and now you're trying to make some decisions, and that's why you go to the patient community. That's why you want to learn what's going on. So, and I think for you, I think maybe as you're talking about more policy and talking to policy makers, I think if you can somehow get back to this need for more data and more quantitative assessments of what's happening with your patient base, that would really be very powerful. There's one company that I forgot to put the slide up from. It's called Treato. That's so treat and an O. Treato, and what they basically do is they scour all these patient community sites. They scour all the sites where people talk about the medications that they take and the experiences they have with it. They filter it medically, clinically, for meaningful versus noise, etc. They discard about 95% of the data. But the data that they do keep, they can actually figure out things around, for example, they had a drug like Singulair. Singulair was given to patients as well, to kids as well. And so they are from Israel. So they found in their data that patients who had kids reported that 20% of the kids who took Singulair actually became suicidal over time. They had depression and suicidal over time. This is an issue that no one had flagged before at the time. And so they said, let's go to a large provider, Kaiser, their version of Kaiser, 5 million members in Israel. I said, can you find this in your medical record, or are we just looking at something that's a phantom phenomenon? They looked into 100,000 records, all selected by the fact, are these kids, and et cetera, et cetera. They found that 23% of the kids who they had treated actually had the same problems, depression and suicidal thoughts, and ended up in mental institutions in some cases. So this is real data, and this is the use of everything that people are saying to turn it into data that is quantitative. And once you use that quantitative data, the message that you're trying to bring across sticks a whole lot more than if it's just anecdotal and it's just qualitative data. So there are technologies being built. I think the use of devices that generate data, there's a lot of interest in this. And part of why I'm bringing this up too is in the past, when we look at patients like me is the ultimate, industry doesn't care, patients care, patients collect and bring a voice and send out a voice. They broadcast a voice, right? That was the original idea of patients like me. What you're seeing right now is industry cares. Industry wants to know what's going on. They want to understand your patient base better. The fact of the matter is they're trying to use initiatives like this. They're trying to use devices. They're trying to find data to understand your patient base better. So you need to be aware that they're doing this, whether you want it or not. And so if you can connect to this desire for data, because data is the language that talks to them, right? So if you can connect to this desire for data, then it will help a lot more in terms of helping them understand what to do, or to hear your argument more better. So, so as to this point about patients or the industry cares and the industry is changing. So one of the other parts that we're talking about mental illness, we just talked about the mental situation before. Virtual care, there's a lot of interest now in making care more accessible. If you want to have a PCP appointment in Massachusetts, it takes about 5 weeks typically to get an appointment, in other places as well. If you want to see your physician, it can take 4, 5, 6 weeks. So there are companies like American Well here, like others, MD Life Care, but there are a ton of others I can tell you about as well, who will basically help you get direct access to patients. The VA just announced that they're going to start reimbursing a telehealth consult the same way as an in-person consult. So not only is the technology now that's being built, now industry is actually starting to pay for it, which is the first time since a long, long time, and it's only the VA. So this is not widespread, but companies are starting to see the benefit of it. So, and part of why I'm laying out some of these examples here is to kind of give you a sense of what you maybe can talk about with your patient base and say, can we use some of these tools? I'll get to the one most salient tool around social media in a second. This one is another company, and this is interesting because we're having a big company, Aetna, together with a small company which is called mHealth Coach. mHealth Coach is actually from Chicago, not from Silicon Valley. What ML Coach actually builds is the future of what we see. So what we see is that there's going to be basically what we call a tech-enabled two-step. So what it means is in the past, the provider was maybe not listening, the physician was maybe not listening to the patient. So now he started to try to instruct the patient better. But the second part is for the patient to actually start sending signals back to the individual physician and the physician to listen. So Florence here is an example. If I see a physician that is Florence enabled, and at this point it's very small, but they just won an Aetna developer challenge, so they're going to start working more with Aetna, so hopefully in the future you'll see more of this. Basically Florence will come home with you on your iPad. You will be given the iPad for free. And Florence will basically help you understand what's going on and why are you taking these drugs. They will keep track and say, hey, I noticed that the last 2 or 3 days you didn't take your Lipitor. Is there a reason for that? Do you understand what are the downsides of this? Or it may notice that you have certain problems. Say, maybe can I notify one of your relatives about this? Can they maybe help with this? So basically they become your buddy, and actually it's come to the point where even though this is technology typically speaking, there's actually the older population who has a lot of isolation problems are known to actually use this system. They're abusing the system technically speaking. In the sense that Florence is their buddy, so they want to keep talking to Florence, and they keep pressing Florence, and it's like, Florence only has limited use at this point. Florence can only tell you about your medication right now and your behavior around medication. So, but it's a sign that you can transcend pure technology and start building a relationship. And I think the part there is that these are things that are happening, and a part of why I'm bringing it up for you as well is you're interested in helping your patients. And these companies are building great products, but they're not always good at reaching the patient, right? They're not really smart about some of these things. They're not necessarily company builders. A lot of the companies that we deal with, they see a clinical problem, they may be a physician, or they may be a patient, and so they build a solution for that problem, but then they don't know how to reach all the patients. They don't know how to reach the whole market. So partially why I'm bringing this up as well is so that you can kind of reach out to your communities, can reach out to these companies and say, we want to help, and this is just in a sampling. There are many other companies that could have put up here. So talking about, so I'll end up with at the very bottom you'll see my link to the social media in the most concrete possible way. So the others are not necessarily all social media, but are more new technology that you're seeing developing that is going to make care listen more to patients. So 2 ones that I think were interesting. So eMetrics. eMetrics really says, one of the ways in which you can make better decisions, better actions, and help your patients is to have data available right when you need it and only when you need it. So eMetrics is a system where, unlike Microsoft Health Vault or any of these databases in the sky, you don't have to upload data and then curate it, and then the provider has to upload data. eMetrics basically is a system they have something called iBlue button. And when you are in the patient, when you're seeing your physician, you can pull up exactly what you need right there and then. The physician can look at all the data that you have, your medical record data, and it's called iBlue button. Maybe I should, before I jump ahead, does everyone know what the blue button is? No. Okay, sorry. Okay, so there you go. Good, thank you. So Blue Button actually is an initiative. What the VA said is to make your medical records more accessible. We can give you all kind of technical, difficult stuff, or we can create a blue button. And if you hit the blue button, and they had to change their interface and their technology a bit, but once you hit the blue button, you can pull up the data, all your data from your medical record in one standardized way. And as a result of that, you will be able to then share it with other providers, with developers who can build products on top of it. That was the whole logic. So what eMetrics actually has done is build something on top of this blue button data, and that's what's called iBlue button. And you can then pull up the data that you need. And this is not just related to the VA data, so there's also, they have Aetna, United, and all kind of other data in there as well. But they'll pull it up right there and only when you need, so you don't have to preload or anything like that. You can share it with your physician. The physician will look at it. They may say, we did this MRI, let me just add some comments to that. They can push it back to you and add it to your medical record right there and then through this iBlue button app. And at that point, it will keep a log of everything. The log will track what you said to your provider, what you shared back with your provider. So if, let's say, you were going to see your doctor, but your doctor was on vacation, so you saw a different doctor, your doctor knows exactly what happened. He said, you gave him this data, he gave you that data, that's why he referred you to this other specialist. In hindsight, I think that's not a good idea. How about we make a change? But he knows exactly what happened. You don't have to call him, you don't have to explain everything and then try to explain the difficult terminology. You can see everything there. What data was exchanged? Why did he make this decision? What decision did he make? Okay, let's keep doing this. But I need to also call someone who wants to help with the psychological help or something like that, right? So eMetrics is a tool that allows this more care coordination and puts more power in the hands of patients. And in the interaction with the physician, because I think one of the drawbacks, one of the complaints that we heard a lot in the beginning was all the patient communities are great, but they're talking to each other. No one is listening, right? So who is listening? So part of what you're seeing with these tools is it is about making physicians listen, making physicians react to what the patient says. I'm going to go across and then down to the ultimate one. So Treato, I think, is another company that's very interesting. Treato, I think I may have so Treato is a company that is very interesting. They will go to all the patient communities. They will go to MedHelp. They will go to whatever patients like me. They go to any other of these sites. And they basically try to mine and figure out what patients are saying about their experience. And then they'll deduct, they'll verify with known clinical side effects of drugs whether it's better for you to take one drug or the other. They will just put the data out there. They're not going to make any decisions. It's up to you to make decisions. But I know that they built this product. They have not given any marketing because they really try to be for providers, and they're trying to really do work with businesses. But without giving any promotion to this, they already have more than 1 million users per month. Some of the examples, let me give you some examples to kind of bring it home. So they had, for example, I think a Twitter or an email from someone who said, I'm a runner. I run for like my last 20 years. But recently, 2 weeks ago, I started having all kind of pain in my knee to the point I had to stop running. Then I went on to Treato, and I found out that actually a drug that was prescribed to me 2 weeks ago actually is associated with joint pain. And so 2 weeks ago is when my pain also started. So I stopped taking a drug, and guess what? Pain went away. So those are very simple ways, and there are many other ways in which you can basically very quickly find out, if I were to go to all these patient communities, what would I find? It's all boiled down, it's all tested, it's all verified. You can actually go down all the way to, so they have about 1 billion patient experiences. And the interesting part is I can say, if I have RA and I am concerned about this, how many other people do have that? How many other, does it change if I'm on this drug versus that drug? The classic example is Avandia, where Avandia, you'll see that it's on all the other side effects, it's very normal, but when it comes to heart risk, it's actually 5x as high. So patients reporting they have heart problems as others. So again, this is also something that if you think about, I hope the FDA is not listening, but if you think about the FDA taking years to figure this out, doing all kind of studies, it literally took me 1 minute to find this side effect in their technology with their data. And it's not conclusive maybe, but it is all the data. If patients are saying it and you're seeing it at certain volumes, you know that this is critical, this is real. So it doesn't explain why or the how or anything like that, but these are tools where, again, you're doing work that's generating all kind of data, it's unstructured data, it's difficult to understand, but people are starting to build tools to actually do more with that, right? They're taking it to the next level, and then you can use that. So because I did this, now we could draw these conclusions, and therefore you should really listen to what I have to say. Talking about listening, that's the final point here about Twitter. I know you guys talked about Facebook and Twitter. So Twitter, so we work also with the White House, more with the people, not the FDA people, but the real White House people who set the stages around healthcare policy. So everything you see about the EMRs, what you see about meaningful use, care coordination, data exchanges, that kind of work, that's what we're involved in. And so they also have something called presidential fellows. And they recently built this new product, and I forgot the name of it. So you can email Amy, and I can find out the name if you're interested in this. But what this does, and this is interesting for you as you're working. This is a product, and they just tried it out on Twitter, and they just tried it out with limited clinical use. But you can see how this can span across Twitter and Facebook and more clinical cases and more diseases. So they basically said, for example, pregnancy is a very predictable pattern. I know exactly what people should be tweeting about if they're pregnant. You know, I'm pregnant now, I'm sick, morning sickness, happy about the baby. They can also tell you when they can also tell you what is the bad pattern that could emerge, which is postpartum depression, right? So if I can track your Twitter handle, and I can figure out that you tweeted about this beautiful baby that you have, and I can figure out that two months later you start tweeting about how life seems like a mess and seems a complete disaster. You can't see living anymore because there's nothing anymore. Your life is disappearing before you. I can figure out you're probably on this bad track. And so what they've actually built is a listening tool. And they can then say, they can alert, they've done this for a provider, they can alert the provider, say your member is having mental issues. Send them a quick tweet, so they'll tweet you directly back, and they'll give you either resources so you can read up on it, saying, hey, what you're experiencing is very normal, this can happen, here are some ways to deal with it, or you can have a link to contact the provider directly. So they'll say, you want to chat, you want to call, and they basically can reach out straight to what you're doing. So this is only a week old, so it's very new as a product. But the point is that everything that you're doing here by technology, can be enriched to get back to these decisions and actions, right? And I think the one part too that I think is important is industry is listening. Industry wants solutions. Industry is just really bad at innovating when it comes to listening to patients. So I think the opportunity for you is to use all these tools that are out there and try to find ways to say, just collecting the patient voice is one thing, but if I can add data to it, if I can make this richer so that companies can actually listen to it and act on it, I'll have a lot more impact. And then I have impact to talk about with the policymaker later on. That, I think, is something that could be the next generation of patient advocacy and patient communities. So, and with that, I think that I come to the end of my talk. So, thank you.
Great. Were there questions for Marco? All right.
Over there.
Yep. Here we go.
So I work for a diabetes organization. One of the things that we have is like an online diabetes support team where patients can come in and submit information. I'm assuming that's getting collected. So is this something that you think could be used to develop a tool for diabetics or those that are living with diabetes to, determine highs and lows? I mean, I know we have like the continuous glucose monitor and things like that, but just generally trying to help support patients. Is that something that might be used in that manner?
Yeah, absolutely. And I think there's a lot of excuse me. There's a lot of interest in things like that. So I think one part that you'll find is that when I say industry is not so good at listening and innovating, is they want that kind of data. They're interested in that kind of data. But what happens is if a pharma company goes to your community, it will be viewed as, they have a hidden agenda or a very obvious agenda, I should say. And so it's the deck is stacked against them, right? So the part of, if you think about what I even mentioned with Trito, the value of Trito is it's unbiased, right? I'm just observing reality. And it's the same as that with a Twitter product at the end there. I'm observing reality. So I think the companies want to learn about your community. So if you can do that, yeah, I think that would be very valuable.
I have, I think, a comment and a question. I'm Tricia Pierce from the American Academy of Nurse Practitioners. I'm a practicing nurse practitioner. I'm an educator. I'm a researcher. I also have a degree in informatics, so I know the seamier side of databases and what they can produce and the problems that they can produce. And one of the things, as in all of those roles, I would raise is the issue of accountability to patients when they're asking about, my glucose is high, my glucose is low, what do I do? And you're using these data to tell them what to do. There's an issue of accountability that I think we've not addressed here that can be really horrendous for any organization. So I sort of, it's like what do we do about that is the question, and it's also a comment. It's something that I don't think we've addressed very well.
Yes, so that's a great question and comment at the same time, as you say. So I think there are a couple of things. One is, so a couple of comments on that. One is, I think that is what was maybe the problem in the past with patient communities. People felt like, well, if 70% of the people say it's X, then I should do X, right? And so there is more of a filtering and awareness that that's maybe not how things work, right? There's a little bit more of a sophisticated approach. One company I didn't mention was called Care and Sync. And so, for example, Care and Sync is another company that tries to take exactly what you're saying and say, we make they do a virtual kind of care team, but it can be your relative, it can be your colleague, it can be others. But it's ultimately controlled by a provider, whether it's a nurse, a physician, whatever it is that happens to be for the case, right? So it's disease specific and your unique case specific. So if you have 4 or 5 different diseases, it's different from if you have one. So what they do is they do allow they have like a risk stratification. So if you're just inquiring, may this be right? Then a colleague can say that. But if it's going to be, are you going to make a change to your prescription, or you can decide not to no longer to take your prescription? Then that cannot be, it cannot go just like that, right? So they try to basically stage what kind of information can flow, because the flip side is, we've had situations where with remote monitoring, where physicians would say, these patients, I get like 100 reactions a day from like 200 patients that I have. I cannot do my work anymore. So Care and Sync and some other companies like On Pulse Technologies, which is here in the East Coast, they're trying to basically build solutions to allow so that I listen in a data-driven fashion to the patient, and I route the decisions to the level of decision maker who can deal with it. If it's just a recommendation, one level, but if it's a prescription change, or should I go to the ER? Whole different question. So different person who should respond to that. But accountability is definitely a big issue. Yes.
Great. Just a couple other quick questions here.
Hi, my name is Jessie Belizer, and I'm here on behalf of the National Black Nurses Association. My question to you is, how do we get physicians and other care providers to listen more to the patients? What do you think that would entail?
That's a good question. So there are multiple ways that we can take that question. So let me be very careful. So I think one part is, so I think there are a couple of things. One is, so if you're talking about physicians, I mean, physicians are, the general sense that we're getting from everything that's happening with physicians is they're really overburdened, they're really overstretched. So they're having so many requirements. One of my colleagues actually practiced in a small family practice, practiced for 30 years, made a mistake, someone is blind as a result of it, and basically is forced to retire early. So they feel like tons of pressures, even with the regular part of practice of medicine. Then you're going to get into other pressures like reimbursement, et cetera, et cetera. Then there's consolidation going on. So there's a ton of pressure. So to a certain extent, part of the reason why it's hard to get physicians to listen to patients is it's not the last of their concern, but it's the least powerful in some ways of their concern, right? Sometimes. So they tend to listen to the administrator, to the payers, to all of those. And the patients, some of them listen to, sometimes don't. I think what's happening is the patient is given more of a voice by others now. So payers are starting to listen more. The more frontier provider organizations are starting to listen more. Kaiser is very active listening to patients. And I think as these companies have success, others are starting to follow that example too. So I think there certainly is a movement towards listening more to patients. But to be honest, I think the hard part is that the individual physician is, I guess that's going back to my first point, is the hardest one to make them listen to patients, because they have so many pressures. So what you will have more is more of the care will move out of the physician's hand. It will move to nurses, it will move to in-home care, other care. So it's more about making all the caregivers that are relevant listen, not just the physician. And I think over time, even Vinod Khosla just a few weeks ago in Silicon Valley said, the practice of medicine will turn into the science of medicine. And it's going to be so complex. It's like flying a 747. There's lots of data that you need that you can't control yourself. So it's going to be more computer assisted. So there will be more ways in which there's a dialogue with the patient, but it will not necessarily go to the physician as a gatekeeper. So maybe that's one way.
My name is Mark Chambers. I have a question regarding how your technology addresses the continuing problem we face with health disparities across population groups, whether given access to different media, etc., among those populations, what it is that's available in the work that you're doing to engage those different populations.
That's a great question. Actually, we organize sometimes innovation roundtables for the White House, and our next one is actually about the underserved patients, so because it's a real problem. So I think there are organizations. I'm not sure if you're familiar with Health eVillages. So they are an organization that's basically trying to bring technology to less developed countries. But they basically try to figure out how, like some of the other examples from the Bill and Melinda Gates Foundation, is how do I create a step function change in the cost of healthcare to give more access to healthcare? But I will say that is actually currently happening more in developing countries, which are very poor, and therefore you have to kind of reset all the parameters. What is happening is that some cases it's actually coming back as what we call reverse innovation. So we would like to serve the poor population here, we can't. They found a solution over how to serve the population in Africa. If they can serve Africa, then they can serve us, right? So it is a weird way of innovation diffusion, but that is happening right now as well. But it's very sporadic at this point.